Hello everyone, this is Doug Nelson with Precision Neuromuscular Therapy, and I'd like to guide you through a little anatomy review for PNMT for the shoulder. So thank you very much for signing up for this seminar. Here are a few things that you should think about as we progress through this particular seminar. The first thing is that this concept of dynamic complexity rather than kind of detail complexity. When we're first learning things like in school, you learn this inserts here and this muscle does that. And it's not unlike going through some sort of, like, you know, in your bachelor's degree, for instance, it's this does this and this does this, really simple. And then you move to another level up, you know, at a master's degree, and you find out it's not actually that simple. Same thing is true with muscles, so that muscles do different actions depending on who they work with. So no muscle does any specific thing. They all work in groups. And so just like life, it really depends on who your friends are. People act differently with different sets of friends. And guess what? Muscles are the same thing. So that will really be true when we start to look at the actions of the scapula. And those actions in general are these 6: elevation, depression, protraction, retraction, downward and upward rotation. Now, there are other nuances in this as well. So if you would take a peek at these things, and if you could, look at the muscles that are involved in all these actions, because you will need to lock those in. When we just start looking at individual muscles, make sure that you review the anatomy of the latissimus. And remarkable in that it has a vertical section and also a horizontal section. So obviously those are going to do slightly different things. The serratus anterior, again, very, very important muscle for both stabilization of the scapula. But when we talk about stabilization, it's that kind of Goldilocks principle, where to stabilize something is great, to immobilize something maybe not so great. So we'll look at kind of both ends of the spectrum, what happens and what's revealed when the serratus is too weak, and what's revealed when the serratus is too restricted, and also how to treat it. And there are several things about treating it that one must be very careful with, and we'll go over those cautions in the seminar. But the next is the deltoid itself. The deltoid is not a muscle, but a series of, depending on people, 7 to 9 different muscles. So a series of which. So we'll go over all the different nuances of that, and it's both superior and inferior attachments. But fascinating muscle in and of itself, and honestly, certainly by me, often overlooked, thinking that the real issues are more intrinsic. This is a shot of the supraspinatus that you don't normally see. You don't normally see it from above, but I love this view because you really get to see it from a superior view and see the thickness of this as it's in the supraspinatus fossa. And then this is the watershed aspect of the tendon, which is then attaching to the greater tubercle of the humerus. And the infra, oh my gosh, wow, what an important muscle for all sorts of reasons. It has a host of struggles. It has a very, very difficult job in the body because it often, if not overwhelmingly, functions as an eccentric load, and that's a very difficult task for a muscle. And again, this and the teres minor are the 2 external rotators counterbalancing the 900-pound gorillas that are on the other side of the equation, which are all internal rotators. So very important muscles to keep healthy. So sort of the counterbalance, again, in one way, if you just looked at this and you didn't see this, doesn't that look like the infraspinatus? So the subscapularis, a pure internal rotator, if you take the subscap, if you take the infraspinatus and you add the teres minor to it, Probably size-wise, that's roughly akin to what the subscap is, but the subscap is just one of the internal rotators, but a very important one both for its movement capacity and also for its additional role of providing stability. So it has a little bit of a role that's a little bit like adding another ligament to the front of the shoulder. So, and there are different signs and symptoms for that. You should also just do a quick review of the pectoralis major, and underneath that, also the pectoralis minor. Just remember, and we'll cover this in the seminar, this is a lovely picture. This is from Barbara Cummings. Most of them look like this. The pictures look like this. Actual clients don't. There are variations in the way this presents. So, you know, the typical ways that we used to teach accessing the pectoralis minor, there's no way in blazes it would ever actually treat the superior sections of that. So we've really altered the way that we address this muscle based on, honestly, for me, one of the first times I did cadaver dissection and went through a bunch of different cadavers and saw the variances in the pectoralis, the presentation, the pectoralis minor, that made me think we need to alter the way we address this particular muscle. And then, of course, the tricep and its little sister muscle, the Anconeus. So very important muscles for a host of different reasons. And again, easily overlooked. So make sure that you look at this in terms of both the attachment of the long head here at the infraglenoid, and then also the medial and the lateral heads as well. And then again, this Anconeus, this will be much more relevant when we look at the hand and arm issues, because it will often present as pain at the lateral epicondyle. So it's always great if you can review that anatomy before you come to class. I think you'll find it very, very useful and very helpful. So thank you very much for watching. I hope you enjoyed it, and I can't wait to see you at the seminar. Thank you.